Okay, so today we're talking on what is epidemiology. So this first lecture of epidemiology, you should understand the concept of epidemiology, why we should have to study this subject. So the study of distribution and determinants of health-related states and events in population and the application of this study to control health problems. So during this time, I will be discussing this term, and we will dig out on this whole term, that what does it mean. So first thing here you can see is a distribution. So let's see, what is distribution? Pattern refers to occurring of health-related events by time, place, and personal characteristics. So distribution is simply the pattern or events. Like which events? They are the time, place, and personal characteristics. So the next thing in this, what is determinants? When many factors combine together to affect the health of individual and community. When people are healthy or not is determined by circumstances and environment. Determinants can be risk factor or protective factor. Determinant effect in individual level or in population level. So these are the simply factor. They combine together, right? They affect the people health. Our communities help together, right? So they can be protective factor. They can be risk factor. So we will talk on this in the next slides in detail. What are these factors? The determinants of the health. So these determinants are social and environmental, economic environment, physical environment, and person's individual character and behaviors. Intervention factors, medications, promoters, and confounding. So let's see. Individual lifestyle factor. Let's see in this picture. If individual lifestyle factors are good, his lifestyle is good, healthy, he's doing exercise, he's taking good food, automatically his health will be really good. Okay. There are age, sex, and hereditary factors also in this determinant, like the advanced age, you see there will be more chance of getting sick, and some diseases are sex linked, like some places where are some, like for example, male sex genetic diseases are more, somewhere the female sex. And then hereditary factors are also important. Some places the genes play a very great role in the disease prevention or disease occurrence. So these all are the factors here. And social and community factors, like let's see here, agriculture and food production. If the agriculture and food production in the society is good, is more healthy, food is more available, so automatically these people, the health will be good. Education in the other side also important. The more you educated, you will have a well balanced life, and then lifestyle, and this lifestyle will help you to prevent diseases. But in some places where you see the education is not good, education level, so then what will happen, that automatically their health status will be not good, because they will be not aware of some health problems and how to prevent them. Work environment is also important. The less in the work environment where you work is more healthy, and less stress, and the work environment, for example, in the factories, there's a lot of dust and other things, so the people will be suffering from more diseases. So living and working conditions, the same thing is like that. And unemployment will cause the poor lifestyle because of lack of, you know, the food, lack of stress, and health and good environment. So these all things involve unemployment indirectly can also cause the health problem. But and then water and sanitation, clear water and clean water can also prevent a lot of diseases. And healthcare services, if the healthcare services are available, and then good healthcare services that are timely provide the education and timely provide the health service. So this will also is a factor that can be very helpful in prevention of disease. So you see, these all are determinants. They can be causing the disease, can be a cause of a disease, and they can also be a cause of prevention of disease. So if these factors are more available in a good way, so they will prevent the disease. So if these factors are not available and lack of these factors, then automatically negative effects will be on health. So what are the health related events? So we talked on the determinants. Now we go to health related events. Like, what are the health related events? Are infectious disease, chronic disease, disability, injury, limitation of activity, mortality, active life expectancy, mental illness, suicide, drug addiction, behaviors. These are the health related events. So these events, for example, if there is a infectious diseases outbreak, or in some area there is a chronic disease, disability, injury, and limitation of activities, the mortality rate is more. So these all things is indirectly will cause a lot of health related issues, right? But if these health related events are in control, in it good. So, for example, let's say mental illness is less in healthy society, suicide rate is good, is not good. Suicide rate is less, and then drug addiction is less. So, automatically, that area, the health level will be automatically very, very good. So, what public health problems are or events are investigated in epidemiological studies. So why we studied epidemiology? So here, what health problems that we will study in this, we need to study is the environmental exposures. We study in epidemiology, for example, air pollution. And because of the air pollution, what happens that the patients will get a lot of allergic conditions that can affect their health, such as, for example, let's say, is asthma. Next is infectious diseases, foodborne illness, influenza, pneumonia. So these are also we investigate in epidemiology. And injuries like increased homicides in the community, natural surge in the domestic violence. So if there is a lot of homicide, there is a lot of violence, and automatically there will be a lot of people that will be suffering from injuries and disabilities, and these things will cause a lot of health issues in the community. There can be also we study the non-infectious diseases in the community like cancer or birth defects, and collect the data in epidemiological studies. And natural disasters in some areas, there's a lot of natural disasters occur. So we also study in epidemiology like these health disasters, like for example, let's say the earthquake. What happens that one earthquake come, all the health facilities, some they also will be get affected. So people will be, for example, let's say the water supply, electric supply, healthcare supplies will be like automatically affected, and then what will happen that you will suffer from, if you are suffering from disease or something, or you will not getting the good food or clear water. So what will happen that your health status will be bad, and you will be, many people will be dying because of not timely getting these facilities. And also there was some issues about the tourism, like World Trade Center or anthrax release. So these kind of things can also kill a lot of people and damage the health problem, health related issues. So these all are the things that we investigate in epidemiology. So what is epidemiology? Really, study of health and disease of the body politic, the population. Actually, it is the study of population. So basic science of public health, right? So what we study here, what cause disease, how does disease spread, and what prevents disease, and what works in controlling the disease. So this all is actually epidemiology. What for? Why we need to study this? We find the scientific basis, like for the health and injury, so that we can promote health, and then determine relative importance to establish priority for research and action. And then we also study this epidemiology, so we can identify in the world populations, like the greatest risk, like what things are at the risk, health related issues, so that we can give the target, timely target interventions to protect all of them and other population of the world, and then evaluate effectiveness of the program in improving the health of the population. And we also, in this study, for example, a disease outbreak, so what we do is we give the timely we just intervention, and after that we check that what happened to this kind of programs we have initiated to control some disease, and how effective they were. So this kind of epidemiological study will provide the data. For example, this kind of event if occur in somewhere else in the world, so that this problem and this kind of program we compare and choose, and then imply them. What for? More study natural history of the disease, right? And precursor through the clinical course. We study the natural history, how this disease was started, sign and symptom, and then how the progress of disease and what happened till the end of the disease. Okay. And then conduct surveillance of the disease and injury occurring in the population, and then investigate disease outbreaks. So this all we will be uh, what for in epidemiology. So we will talk on this natural history, surveillance, and outbreak now. So natural history of a disease, as I have told you, disease is a process, right? And then natural history, the entire process of development of disease. So that will tell us we can expect what we can expect to happen. Okay. And it will give us also a concept that how we will control this disease. So natural history of the disease, like for example, in the pre-pathogenesis period, there will be no disease yet. The course of disease in man, right? There will be no sign and symptom, but the pathogen will be there. There are three factors: interaction and host of agent, no disease, for example, agent, host, environment. These three factors will all the time will be fighting with the disease. So, for example, if the agent, let's say virus, is not too much strong, the disease course will be not long and it will be controlled easily. Host health and his immunity is if very good. This can also help in prevention of the disease and cure of the disease quickly. Our recovery from the disease will be very quick, and environment is good. Environmental factors are fine. Also, it's very helpful in prevention of diseases. For example, in the beginning, let's see in the clinic, first is the early pathogen, and then there will be the early disease. If it is not treated and these factors were not good, so what will happen? The disease will change to advanced pathogenesis, and then advanced disease state either will cause convulsions, chronic state, disability, or death. So these four outcome will be like advanced pathogenesis. These four outcome will be there. But if we control the disease in the pre-pathogenic stage, then what will happen that or you can say in the early pathogenic state, pathogen state, so it will be more good or less damage will be occurring. So this how this epidemiology will tell us the natural history of the disease, how the disease will start, what will happen initially, and what will happen in the advanced stage. Okay, epidemiologists are required to have some knowledge of public health because there's emphasis on disease prevention, clinical medicine because they are also the health related issues. So we should be having the knowledge about the disease and their classification, diagnosis, and pathophysiological knowledge is important because we should will be helpful for us to understand the pathophysiology of diseases, how they work, how they spread, how they cause disease. So this knowledge is important. Statistics, because in epidemiological data can also epidemiology data is important. Statistical epidemiology should know the statistic because they need to quantify disease frequency and relationship to antecedents. And social sciences because need to understand the social context in which disease occur and present. So this all data is required for epidemiologists this to have this knowledge. Challenges of modern epidemiology: globalization, population overcrowding, ease of travel, importance of food, and then warming climate like pollution, virus threats, and natural disasters. So these, like overcrowding, what will happen that in overcrowding there will be more chance of, like for example, some viral diseases and some other disease. When there will be overcrowding, their chance of a spread is too much. And ease of travel, because these days the travels are really easy, so the diseases transferring from one area to another area is also very quick. And importation of the foods, like some food, if they are they should be like sometime not properly screened or checked. They are not fine and toxic, so this also can cause a lot of health related issues. And warming climates like pollution is the biggest challenge to, for example, producing some diseases like asthma, and then new viral threats and natural disasters. so they will also cause a lot of health related issues. Okay, epidemiology also called the population medicine: who, when, where, what, and why, and how, right? So this all questions we also answer in epidemiology, that who is suffer, when suffer, where suffer, and what happened and why happened and how happened. So objectives of the epidemiology actually to describe the health status of population, to explain the etiology of the disease, means cause of the disease, and to predict occurrence of the disease, and then to control the occurrence of the disease. So this is all about the epidemiology introduction we have studied. In the next lecture, we will further talk on these, like, how to calculate these epidemiological values and, this all. So thank you very much for today.